the next item on the agenda, which is also important, and that is to recognize National Colorectal Cancer Awareness Month. And that's one of the reasons why I'm dressing in blue today. It's important for us to recognize this important month, particularly as we shed a much brighter light on public health in our community. The disparities that existed prior to the pandemic were there. They were something that many of us have been trying for years and generations to address. But really, the immoral outcomes as a result of the pandemic shed light on the fact that we need to double down our efforts to raise awareness and to ensure that we proactively reach, especially our communities that have been disproportionately impacted in so many ways by our public health challenges. And this is a good example of that. So this is an issue that impacts our entire community. And I have somebody in my family who is deeply impacted by this issue, and I'm sure there are many others as well. So I want to thank our advocacy groups and organizations and community and civic leaders for continuing their work. And I turn it over to the county executive now to make some comments as well.
So many people don't realize that colon rectum cancer or colorectal cancer is the second leading cause of cancer deaths in both men and women. And that's why raising this issue is so important. If you're 50 or older and have not been screened, it's time to schedule your first screening appointment. And if you're Black, you're in a group that has the highest rate of sporadic and non-hereditary colorectal cancer in the United States. Nutrition, physical inactivity, obesity, smoking, and family history can all contribute to a person's chance of developing colorectal cancer. And for years, I've been going to get my screenings, and I encourage everyone who is 50 or older to do the same. We've learned a lot over the last few years that good health can protect us from disease. We can protect ourselves from colorectal cancer by getting screened, and in some cases, changing our lifestyles. And I encourage everyone to talk about colorectal cancer with family members and friends, and to make sure that they get screened. Talking about it can save lives, and that's what this month is all about. It's about saving lives. As somebody who's gone through the screening, it is not as bad as people sometimes think it's going to be. Then I was always really clear when you looked at the stories about colorectal cancer that this is something that is treatable, but it's especially important to find out if you have it early, and to get over the squeamishness and make sure you get yourself screened. So I encourage everybody 50 and older to do that.
Thank you so much, Mr. County Executive. I totally agree. And I'm turning 46 this year. I will be getting mine soon as well. I think it's really important for us to announce that publicly, to eliminate the stigma and encourage everyone that this just needs to be part of your regular checkups. This is just part of the deal of getting older, and it is okay. We now are going to hear from two tremendous community leaders. First, Ms. Lisa Rule-Patterson, followed by Mr. Quayne Drabo. Lisa?
Thank you for wearing blue today, Mr. President. And as Mr. Elrich said, colorectal cancer is the second leading cause of cancer-related deaths in this country. And for my family, that statement hits very close to home. In 2010, my mother-in-law, Mary Ann Scruggs, lost her life to colon cancer. She was not there to see her son get married or to see her grandchildren grow up. Then in 2019, my own mother, Janet Rule, passed away as a result of rectal cancer. My children still talk about their Grammy every day. Both women were only 59 years old. That's why this proclamation is so important to me. Colorectal cancer is not a disease that is frequently discussed, yet it is very prevalent in today's society, and it's quietly devastating families, just like mine, all around the world. Before my mom passed away, she asked me to become an advocate, and that's why I'm here today. My hope is that this proclamation and your encouraging words helps people to have frank and open discussions about their body and be up to date on their preventative screenings, such as getting their colonoscopy. While the proclamation cannot bring back the family members I have lost, I want to thank the council for giving me this opportunity to share my story and to raise awareness for colorectal cancer in the hopes that future lives may be spared. Thank you.
Lisa, thanks for sharing that story. That's super, very powerful. Mr. Drabo.
Good morning, County Executive Elrich and County Council President Albanez and all County Council members. My name is Kwani Drabo. I am a community organizer with the Colorectal Cancer Alliance. And I just want to briefly drive home some of the points that you all just made about the importance of getting screened and the latest updates as concerns colorectal cancer. As some of you may know, or some may not know, recently, as recently as last May, the U.S. PTF, which stands for the U.S. Preventative Services Task Force, dropped the screening rate, the suggested screening age, from 50 down to 45. So I'm very, very happy to hear you'll be taking advantage of that, County Council President Albanez, because it's very important to get your screening as soon as possible. And in addition to that, in our country, 1 in 24 people contract this disease within their lifetime. So more than likely, you know of someone that has battled the disease, or you know someone that will be battling the disease within your lifetime. And in addition to that, which is probably one of the most troubling things about this disease, that during COVID-19, screening rates have dropped by nearly 90% across our nation. So as we go ahead and try to creep back into normalcy as it concerns moving past COVID, it is very, very important for a lot of us to go ahead and get back to getting our regular screenings done for all cancers, but especially for colorectal cancer. And I would just like to say thank you again for issuing this proclamation. And thank you once again for wearing blue and recognizing the importance of getting the screening done that's necessary.
Thank you both. You both nailed it. That was like the perfect compliment to describe this issue. All right, Mr. County Executive, did you get the proclamation?
I did get the proclamation.
Great. So we will go ahead and do what we did before. I'll kick us off and then kick it over to you.
Okay.
Proclamation of the Montgomery County. Whereas Montgomery County, Maryland celebrates Dress in Blue Day and March as National Colorectal Cancer Awareness Month to bring greater awareness to colorectal cancer. And
whereas colorectal cancer is the second leading cause of cancer-related deaths in the United States for men and women combined. And
whereas overall, the lifetime risk of developing colorectal cancer is about 1 in 23 for men and 1 in 25 for women. And every 10 minutes, a life is lost to the disease. And
whereas a life-saving screening test is recommended to individuals over age 45 and those with a family history to combat the disease. And
whereas Montgomery County, Maryland has joined with the Colorectal Cancer Alliance to increase screening and save lives in Montgomery County, Maryland and across the county. And
whereas education and increased awareness can help inform the public of methods of prevention and early detection of colorectal cancer. And
whereas our goal is to March 4th to save 100,000 lives through timely screenings, as this cancer has a 90% survival rate when caught at the earliest stage. And
whereas Dress in Blue Day and National Colorectal Cancer Awareness Month brings greater awareness to the disease and the importance of being screened.
Now, therefore, it be resolved that Mark Elrich, as County Executive, and myself as Council President hereby proclaim National Colorectal Cancer Awareness Month, Dress in Blue Day in Montgomery County, encouraging all individuals to work together to promote awareness and understanding of colorectal cancer and the need for screening to end the disease in our lifetime. Presented on this day, on this first day of March 2022, and signed by myself and the County Executive. Thank you all again so much for your leadership and advocacy, and thank you again, Lisa, for sharing your personal story. We will carry forward this message this month and the whole year. Thanks a lot.